So my name is Kimberly Snodgrass, and I'm a registered dietitian nutritionist. And I currently work as a renal care coordinator, meaning that I work with people who have problems with their kidneys. So I counsel them on proper diet and nutrition, what they should eat, what they shouldn't eat. I see them in the clinic, I call them on the phone, and we keep a really good rapport with these patients because we want to make sure that they are properly consuming the right things for their disease condition. And they want to call me, I guess, AKA the food police, if you will, because I kind of just let people know you're in your lane or you're not in your lane in terms of their diet and what they're consuming on a day-to-day basis. So I see them more in a clinical setting. I actually have 5 offices that I cover, and I also do some work from home. So a typical work day for me can vary, but what I do is if I have to see a patient, an initial visit can take up to an hour. A follow-up visit can take up to 30 minutes, which is a half an hour. And I'll sit down and I'll look at their lab work. We all have to typically go into the doctor's office and get our blood drawn. And I look at their blood work from their annual exams, and it lets me know if they've been eating properly. So if they've been eating the right fruits and vegetables, if they've been, consuming a high salt diet or a low salt diet, those type of things that I look for. And then based on their laboratory work and what they tell me, I go from there and counsel them on, Mr. Such and Such, you need more broccoli, or Mrs. Such and Such, you need more carrots, and Mrs. Such and Such, you don't even drink enough water. So it can vary from patient to patient, but my typical day, I may see 8 to 10 patients in a day. Kind of just fell into the field. My mother told me that I should go to school to be a dietitian, and I guess just being a good child, I listened. But one of her good friends that she worked with was a dietitian, and so I guess she saw something in her that she also saw in me. Maybe my love for food and my curiosity and me always asking questions about this vegetable or this fruit and how many calories are in this, mommy, and what will this make your body do? And so she's like, you'll be a good dietitian. So just kind of fell into it, and I actually really love it. What makes it so unique is that in the US, there's only 2.6% of African American dietitians, so there's very few. But a lot of the chronic diseases that you see are in the Black and brown community. So I feel like our representation isn't enough. So I'm very proud to say that I'm one of very few. And the way I fell into the kidney disease realm is people typically, and more so specifically dialysis, people who have kidney failure or end-stage renal disease, is that uncontrolled diabetes and uncontrolled hypertension or uncontrolled high blood pressure can lead to your kidneys failing. So that's kind of how I fell into that. And I would say that at a young age, I was also very serious about my academics. Like I would dedicate at least 1 to 2 hours after school to study, and I wouldn't even eat dinner until my homework was done, which is not good, but I was very dedicated to my studies. So, and I come home, eat a snack, do your homework, okay, then we'll have dinner. But just carving out that time and having a set schedule and just staying focused, knowing what your goals are and setting those short-term goals and those long-term goals, because education is so important. So staying focused, setting goals. In order to help people, you have to listen to what they're telling you. And, you have 2 ears, so you should listen more than you talk is what I was always, what I learned. So being able to be an effective listener, an active listener, and being able to repeat back to that person, so I'm hearing you say X or Y or Z, so that you actually took in what they were telling you. And then to actually be an effective communicator, sometimes when I talk to my professor or someone, academically, they use different terminologies for it. But if I'm talking to a patient, you want to bring that down a little bit so that you can relay that information so they know exactly what you're asking them for and what you're talking about. So I believe an effective communicator will be able to communicate with anyone in any grade and on any level. Get a mentor. Find someone that's in a profession that you love or that you want to go into, and try to see if they would mentor you or know someone who would mentor you, because they can kind of walk you through what the steps would be in order to be successful. I didn't necessarily have a mentor, but I had some really good academic advisors in college, which I guess you can say in a way are mentors unofficially. And, they say, Kim, you need to do this, you need to apply for this internship, you need to take these classes, these are your expectations. And they kind of help me map out my course. And, I'm happy to say that now in my career, I'm also a national spokesperson for the Academy of Nutrition and Dietetics, the first in my area, and I think the first African American from our area. So education was key. And that once you received your education, that was something that no one can take away from you. And it offers so much stability. I think the skies are the limit. If you want to be the president, if you want to be a teacher or a judge or a lawyer or a dietitian, you should work hard and go for it. And just know that it sometimes will be challenging. But, if you have someone there to kind of guide you and mentor you and don't be afraid to ask for help. If you need help, you definitely should ask for it. I think sometimes we get into that thing like, I'm scared to ask for help. What will people think? But part of being strong is knowing when to ask for help and knowing that you do need help, because we're a village, whether that be a dietitian that you may go see for counseling, or may that be going on the Michigan Academy of Dietetics and Nutrition, our website, and finding the dietitian, asking those questions and saying, hey, can you help me? This is what I want to do and who I want to be. When you make those connections, you go have one of those dietitians to mentor you in your career. And I think that's a good goal to have. The thing that fills me with joy and excitement is seeing people reach their goals. When I see someone with high blood pressure, bring it down because they've lost weight, exercise, and they've watched their diet, that's motivation to me. That's someone that I've helped not have kidney failure or possibly go on dialysis. That feels really good. It can be challenging when you try to help someone and they're not following the regimen that you laid out. I mean, sometimes it can be discouraging, but you have to realize that everybody doesn't reach the same stage at the same time. So you just have to continue to put in the work and be persistent. But for some, that can be a challenge. This is one of the awesomest positions that I think was created. It's a well-kept secret that should not be. We're very valued on the medical team. We work alongside doctors and nurses and social workers. I believe the hours are flexible, the pay is good. It's a really good job. So I think more people should go into it.